to the webinar with Dr. Jim Shire with Shire Facial Plastic Surgery here in Chattanooga, Tennessee. This is going to be a question and answer series. My name's Clay Posey. I'm just kind of being a host and running the technical side of this, and I'm going to hush in just a minute. But I want to give you guys a few operating instructions. This is a question and answer session with Dr. Shire on facelifts. I know you all have expressed interest in that, and we're glad to have you here today. Just a little bit of housekeeping. We are recording this, so you'll be able to get a review of this recording later if you'd like. If you look down at the bottom of your screen where you're watching this webinar, you'll see some controls. Over toward the right is a little thing with a couple of chat bubbles, a little button that says Q&A. You can just click on that, and that's going to pop up a little chat bot, and you can move that box around on your screen wherever you want. You can type your questions in there. Dr. Shire will be able to see those and be able to address them as well. You can probably see Dr. Shire on your screen now. Jim, thank you for taking time out to talk to some of your patients. I know you literally just walked out of surgery, so I'm going to kind of turn this over to you and let you start, and then we'll wait on some questions to pop up here and go from there. Thanks again, Jim.
Great. Well, welcome everybody. It's nice to have you here. This is going to be a question and answer. So really what this is about is answering your questions, things that you may have questions about, concerns, interest in. And I'm here to kind of help you answer those questions and try to figure out the best way of getting your questions answered. This seems to work very well on the Zoom webinar platform. So I'm here for your questions. So if you can start with some of your questions, I will answer them as soon as I get them. Prior to this, I had a few questions sent in, and one question was about patient's satisfaction. And if you would happen to go on my website at plasticsurgeryartist.com, there is a section on reviews, and there are a lot of patient comments on how they feel things went, and which is a pretty good representation. The patient, the questionnaire that I saw, they wanted to kind of understand what the early and long-term results were like and what to expect. Most of our patients with facelifting have limited bruising and swelling and really very, very little discomfort. So they feel good and they look good. However, we do restrict activity post-operatively until you're healed. We have to make sure that all the inside pieces and parts all reattach and heal. So the things we want to avoid in that recovery process is anything that would make you swell, anything that would make you bleed or bruise. So that's bending, lifting, straining, anything cardiovascular. And it's going to take at least 28 to 36 days for a person to heal. So during that period, we limit those activities. So if your normal routine, work, whatever, does not involve bending, lifting, straining, and cardio, you can probably go back relatively quickly. And most of those people that do not have strenuous activities as a job are back to work within 2 weeks. Now, it does take time to heal. By about a month, we're going to get you back doing your normal activities, but the healing process continues. So you're going to see continued improvement with time. So you will usually look better at 3 months than you did at 1, and you'll look better at 6 months than you did at 3 months. And this continues all the way up probably for the first year. So you will be getting that healing process for that first full year. Now, most of this you yourself are going to notice because you're going to feel it, but no one's going to see it. So, you know, people on the outside are not going to really know, but you will because you're actually feeling it more than seeing it. We do have another question here on how long a facelift lasts. And that's a two-part question. Done properly, the way we describe a facelift here is that we structure the surgery to not just pull and stretch, but to actually reposition in the right place tissues that have fallen and that have gravity has taken a hold of, as does the aging process. So my two-part answer on how long the facelift lasts is, first, it's going to last forever because the work that we do is not going to go away. However, part two is the clock is going to keep ticking, which means I can't stop time. So if we do a procedure, a facelift, and we turn your clock back, then the clock is going to start ticking again. And depending on how fast your clock moves is going to depend on how long the appearance of that result is going to last. However, as the clock keeps ticking along, you'll always be better. If we start off here and we turn your clock back, and then the clock keeps ticking, it's going to keep moving this way. We're always better off than if we hadn't done it before. So whether it be 5 years, 10 years, 12 years, whatever it is, you'll always look better than if you hadn't had it done before. Now, what makes that aging process are all things that you and I cannot control, which means aging has to do with genetics. It has to do with your life habits, dieting, the amount of sun you get, your alcohol intake, were you a smoker, all your habits go into that aging process. And then your health also has a big part of it, because people who go through an illness or a trauma, that comes off as an aging process. So the aging process we can't control, but we can turn your clock back, and that's what we're doing here. Another patient asked, how many patients have had second or multiple facelifts, and how far apart are they? Well, that again comes to how long does this last? That means that the average person, and this is really an average, is about, I would say, 10 to 12 years before they start seeing those signs of aging come back. Some of them will come a little earlier, some of them a little later, but on the average, 10 to 12 years. And at that point, we could possibly look at doing a revision procedure or a second procedure. And that's a personal decision. There's no have-tos. It's when it bothers the patient. So, I mean, I have seen patients at 8 to 9 years that are ready to have it done again. And I've seen patients at 15 years that still aren't ready and they're still looking great. So it's really very, very individual. With the technique we use, however, we can do as many revisions as a person would like. There's no limit to that because we're not burning any bridges as we do the surgery. So we do have that option of going back. Plus, there are some non-invasive options that we can do now that also can boost what those, instead of going through another surgery, we can sometimes, in some patients, do other little procedures to help give you a little boost. Another question we have here is, what's the difference between a facelift, a mini lift, a neck lift? And that's a really good question because we do have patients, coming in asking for certain things, and the information they get usually comes from either social media or reading an article or an advertisement from another medical facility. Most of these terms are semantics. which means that different doctors use different terms for exactly the same thing, or they use the same term for different things. So it's depending on how they use the term on some of these operations or what they actually represent. So you can't just go by the term facelift or mini lift or neck lift or whatever, unless you are very specific in that, because most doctors use the same term for different types of procedures. And depending on who you're talking to and what the situation is, those terms can be different. As an example, what I like to do is describe the procedure that we are going to be doing as the name of the operation. So when I say facelift, we're usually talking the lower facelift, which means from about your cheekbones down past your jawbones, including the neck. So the real term is called a cervical facial rhytidectomy, or a lower face and neck lift. So that is what we're doing here. And that is taking care of that entire bottom. And we refer to that in our practice as the facelift, because it is the lower half of your face that is being lifted. If we were going to do the upper face, it would be a brow or forehead lift. So that's how we're going to decide here in our practice what these things are. Now, what happens to be a mini lift? And to be honest with you, I don't know, because every doctor has his own term what a mini lift is. What I can tell you, it's less than a facelift. So it's not quite the full operation. Why someone would want that, I do not know. But I'll give you some explanations of what different doctors call minis. Some doctors call a mini lift just making an incision around in front of the ear and behind the ear, lifting the skin up and just pulling the skin tight, cutting some excess skin off and sewing it back together again. They are not doing anything to the muscle layer underneath, which means the jowls and the hanging neck will come back almost immediately, because skin is very elastic, it stretches, so that initial pull is not going to be very long lasting. It is very transient. And in addition, you will get a pulled look and you'll get some larger scars because there's tension on that suture line. So that's something I don't ever recommend doing, and we don't do that in this practice. Other doctors call their mini lift very similar to what we do as a regular lift, but instead of lifting the entire cheek up, they only go about 2 or 3 inches. And then they just put 2 or 3 little stitches in to pull it up and then to tighten it. So it's a shorter scar. It doesn't get as much of a lift there. And some doctors call that their mini lift. So different doctors have different terms for the same thing.
Dr. Shire, got another question here that's come in. Could you talk a little bit about what happens during the surgery? I know the patient will be asleep, but to give them an idea of what's going to go on when the surgery happens.
What goes on? Well, that's where we do the surgery. You know, the patient will be brought to the operating room, and we use a conscious sedation anesthesia. And that is the type of anesthesia that is delivered by an IV that makes you sleepy, that makes you not remember a whole lot, in fact, nothing at all, and you won't feel anything. Now, if anyone has had a colonoscopy recently, this is probably the same type of anesthetic you had, that you'll seem like you just fell asleep and you're going to wake up in another room, and you want to know when they're going to get started. So that's the conscious sedation. It is not a general anesthesia, so we don't get the nausea and we don't have the extubation and taking over your breathing for you. So it's much safer and it's much easier for the patient, and as a surgeon, it's much easier for us also. We then drape you, make sure your you are all marked up, and then as the procedure goes on, we just go through the procedure step by step. You know, I don't know how much, I can't really go into detail if you don't have a knowledge of anatomy and things like that. But what we're doing is we're lifting the skin up off the face, because this operation is not about skin. And we're just finding that muscle fibrous layer, lifting that up and repositioning it back to where it used to be, then securing it by sewing it to the muscle on top. And when we reposition that muscle layer underneath back to where it used to be, then all I have to do is lay the skin back down. If there's excess skin, which there usually is, we trim that off around the edges and sew it back together, but we're not stretching or pulling the skin at all. I hope that answered that question. Also have another question here, and that question is about weight loss, and another one about smoking. The weight loss is a good question because we do get that a lot, that question. Weight will affect your result. Ideally, you want to do this when you're at your ideal weight or the weight that you're going to be maintaining. Now, I understand that sometimes we all are a little more than we want to be, but that's our weight, and that's our natural weight. And we're not going to be losing it just to have an operation, because that's not our natural way we want to live. And this isn't about changing your lifestyle. This is about enhancing your lifestyle. But if you were considering losing weight, we would want you to be probably within 10 pounds, maybe 12 pounds of that goal weight prior to doing the surgery. Losing more weight than about 10 to 12 pounds after we do the surgery will cause some decrease in volume, and you will sag a little bit. So ideally, you would like to have the weight loss prior to our surgery. So if you are planning and have that as one of your goals to lose weight, we always recommend you do that prior to surgery, as opposed to waiting to do the surgery, then being motivated and losing it afterwards. As I said, you don't have to lose it all. And the other thing is, be realistic with yourself. Find out and be honest what you can maintain. I mean, say you want to lose 20 pounds. Can you maintain 20 pounds afterwards? Because the worst thing that I can see you doing is losing weight and putting weight back on and yo-yoing up and down. That's the worst thing. I'd rather you not lose anything than to lose and put it on again. So lose what you can easily or safely maintain, and be happy with that result, because I think that will benefit you more in the long run. The other question about smoking is critical. We do not do facelifts on people who smoke. And there is many important reasons, and I'm not alone in this. All plastic surgeons who do facelift surgery will tell you the same thing, that we do not operate on smokers. And the reason is, and everybody knows smoking's bad for you, that it's gives you lung disease, and it can cause cancer. And those, we all know what great reasons not to smoke. However, for surgery, there's something completely different at play here. And that is that nicotine that is in cigarettes and in smoking is a strong, what we call vasoconstrictor. It shrinks your blood vessel size down from big to little. And how we heal is by blood flow. And if you decrease the amount of blood flow to an area, you will not heal, which means you're increasing your risk of infection. You're increasing your risk of slow or poor healing, and actually, you're really increasing the risk of the skin that we lift up dying because it doesn't have enough blood to live. And we have seen in smokers these issues. Now, once you smoke, that damage is done and it will never return back to normal. I don't care how long you've been off of smoking, but it will improve. So our minimum is 4 months that you have to be off of anything that contains nicotine. And yes, not only smoking cigarettes, but also the nicotine gum or patches or anything that has nicotine in it, you have to be off of, because we get that vasoconstriction of the blood vessels. So 4 months is our minimum that you have to be off of all those before we can consider doing a procedure. Now, a year is better than 4 months. 5 years is better than 1 month or 1 year. 10 years being off of it is better than 5 years being off. So the longer, the better, but you're never going to get back to normal. Okay. Here's another question. Are there any non-surgical procedures that are new within the last 5 to 10 years, specifically to help with lines around the mouth or tightening up the jawline? Yes, there are. And we have a few things. In the last probably 2 to 3 years, we have brought in the Embrace RF machine, which is a machine that utilizes a technology called bipolar radio frequency. And radio frequency is just a form of energy to generate heat. Bipolar means we're controlling the energy to deliver it exactly where we want it to be. And what we do, this is a minimally invasive procedure. You are awake when we do it. And what it does is it tightens the skin from about a line from the corner of your mouth all the way to your jawline, including your jowls and neck. So you're going to get that neck and jawline tightening, okay? This procedure takes about an hour and a half. The recovery is only about 10 days or so afterwards, so you can get back to doing things normally. Your results are not the same as a facelift, however. You are getting a percentage of what a facelift would give you. And that percentage is determined by you as the patient, what you're bringing to us. First and foremost, your elasticity. Younger people have more elasticity, so you're going to get a longer, better result with more elasticity. The older we get, we lose our elasticity, and that tightening isn't quite as effective. So as an example, in your late 40s, early 50s, you're going to probably see about a 70% improvement over where we start. When we get to your 60s, we're going to see about a 60% improvement. And when you get to the mid 60s to 70, you're down to about 50% improvement. And after about the low, maybe 70, 72, we don't even recommend doing it because the percentage starts to drop significantly. But it is an option for many, many people. It's an option for people who don't need a whole lot done early on when you're younger. It's an option for patients who would like to have and need surgery but can't have a surgical procedure because of a medical condition. So there are many, many reasons. And if you're just not ready for it and you want something temporarily before you do it, this is another option. So are there any, I hope that answered those questions. I would like to kind of demonstrate and maybe bring up a few pictures just so we can show some things here and demonstrate kind of some of these questions that we've seen. And so we're going to talk about some early healing, and I'm going to share my screen here with you for a second. Okay. All right. So I hope you can all see my screen. And these are just some immediately after surgeries on how quick the recovery is. The bruising and swelling go away very quickly. And this is from POD, by the way, means post-operative day. So this is the day after surgery, 3 days after surgery, and 7 days after surgery. And I'm just going to show through some of these very quickly. That this here's from day 1 to day 3 after surgery. And here she is at before, and here she is 3 weeks after. Again, please notice how natural, even early on, with no hair loss, ear position and shape don't change. Here we are again with somebody 1 day after surgery, 3 days after surgery. And here she is before and at 2 weeks. And again, as I said, if you have a non-strenuous job, you could be back to work within 2 weeks. So, you know, the recovery is very, very quick. But the results have to do with what we do and how you take care of it. It's so important. Let's go to a few before and afters. So again, we want to make sure that people look natural afterwards, that they have, and I'm just with a pointer showing you the nice clean jawline, the clean neck. And there is no telltale signs of having been pulled or stretched or having your anatomy changed in any way. About a third of our patients are men, and this is becoming more and more common nowadays. Again, men don't have hair to hide things, so we have to be very conscious on hairline and beard growth that we don't change anything. We don't want people to look different. We just want them to look like they used to, refreshed, renewed. Again, tired, sagging, brought back, refreshed with a better jawline and neckline. Again, before and after, here we added a little bit more augmentation to the chin to give her a more balanced jawline and more definition. Please note that her hair does not change and her ear doesn't change. And you can see with a very short haircut, you can't tell anything was done. Okay. Again, very natural look and very, very quick recoveries. Again, all different people get different results because we have to do what the issue is with the person. We don't do the same thing for everybody. It's the same thought process, but everyone is a little different. So again, that secret to that really nice look is a clean jawline where we have that straight line, that the jowling is not hiding your jawbone, and that we have a clean face neck definition. Okay. Another question we had was about incisions and where they're made. And let me just point that out to you. That our incisions, so we want to preserve the hair and the anatomy of the ear and the face. So it follows the hairline in the front, comes down in front of the ear in the natural crease, behind the ear in the crease, going up to the top and paralleling the hairline. So this is with the stitches in place 3 days after surgery. This is the exact same patient 3 months after surgery, and you can't see any of that. It's all healed very well. So you can see the hairline, the incision line is almost non-visible in these patients. Here's a man We have to preserve this area where his beard stops growing so he doesn't have his beard growing up onto his ear. So we wanted to maintain that natural appearance without changing the hairline. Again, a very natural look, no hair loss, no change in the ear anatomy. Very, very important, because these are the telltale signs. You can see behind, we don't have the scarring, we don't have the hair loss in front or behind the ear. It's very difficult to see. Okay. Do I have any more questions? Because we're getting up at the end of our half an hour here. And so I am going to wrap this up now. Hopefully everybody had most of their questions answered, and I hope I touched on things that maybe spurred your interest or answered your questions. Hopefully I relieved any apprehension you may have. But if you have questions and you have specific things specifically to you, we really would like you to give us a call, and I would be delighted to see you, look at you. We'll go through, put you on the computer, show you what can be done to get you to look the best and address all your concerns. So please give our office a call. Our number is 423-870-3223. It's easy to remember. It's 870 FACE, FACE. So please give us a call, schedule an appointment. We would love to see you, love to talk to you. I'm sure there's something we can do to address your concerns and interests. I hope everyone is being safe. Wear your mask, social distance, wash your hands. It's very, very important in this time. We're all trying to do our best here to keep everybody safe and healthy. But again, please stay safe, healthy, and give us a call as soon as you feel the need to be comfortable with coming in. Thank you again for joining us. And I will do one of these again, maybe in a few weeks again, and we'll pick a different subject to answer questions on. We do appreciate your input on all of this, and have a good day. Thank you.